Alright, so today we're going to be going over the physical examination of the ears. So to start off, we're first going to inspect the ears bilaterally. So I'm going to have you first look ahead at me. Okay, so we're checking for symmetry. Okay, so symmetry for bilateral ears, they're equal. Okay, appropriate normal size. The next thing that we're going to do is also inspect on each side. Going to be checking for any lesions, any painful areas, any lumps. Okay, any pain?
Mm-mm.
Any pain?
Mm-mm.
Okay. Okay, other side. Okay. Any pain?
Mm-mm.
Okay. And then what this is doing is checking for any bacteria or any infections on the external ear, because if there's a lot of pain or any hearing loss or any discharge, we can suspect infection. But so far we don't see any discharge, we don't see anything abnormal, no lesions, no open area, no bleeding, nothing like that. So that's good, that's a normal finding. And then another thing that we could do too is we can, prior to them coming in, we could test their gait to see if there's any instability, any dizziness or anything out of the ordinary. But as he came in to take a moment to sit down on the examination table, he was steady. So we don't see any issues with that. So the next thing we can check too is their speech. So when you're asking questions, we want to make sure that they're answering appropriately. The speech is not too loud, not too soft. And we want to ask questions like, how is your hearing, any loss, things like that. So next, moving forward, we can, inspect the internal structures. So the external structures are all normal, nothing abnormal. Next, we can go into the middle ear and then thus into the internal canal where we could see the tympanic membrane or the eardrum. So we're going to do one at a time. So the next thing that we're going to do is we are going to, since this is an adult over the age of 3, we're going to pull up on the pinna and back. Okay. And we're just going to go a little deeper. Okay, tympanic membrane is pearly white. There's a collection of some earwax. I see some dryness of the cerumen. Okay, good. No lesions, no discharge. Tympanic membrane is not bulging. It's intact. Okay, next thing, we're going to be pulling up and back. Okay. And, sorry. Okay. Alright, tympanic membrane, same thing. It's pearly gray, no lesions, no abscesses, nothing abnormal. Just a collection of some earwax and cerumen, dry and wet types in both ears. Okay, so the next thing we're going to test is his hearing acuity, his ability to hear. So first we are going to do the Weber test. So this is going to be placed on top of his head, and we are just going to see if he can hear and feel the vibrations bilaterally in both ears.
Yes.
Okay, good. And not one side is stronger than the other side? You can hear it equally?
Yep.
Okay, and then the next one we're going to do is this is going to go behind the mastoid bone, and this is going to be, so that one was the Weber test, this one's going to be the Ryan test. So we're testing the bone conduction versus air conduction. Okay, now tell me when it starts.
Now.
Okay, and then I want you to tell me when it ends. Might be for a while.
End.
Okay, good. Other side. Can you start? Do you feel it?
Start, yeah.
Okay. And then just tell me when
End.
it ends. Okay. Good. Okay, so then now what it's doing is it's testing to see if there's any conduction, so conduction loss. So we're also testing to make sure there's no sensory neurally loss or any, conduction. So that could be because of a blockage or it can be a nerve issue, but everything's within normal findings. He has a positive test for both, positive Ryan test and a positive Weber test. The next thing that we're going to do is we're going to do the whisper test, and then that's going to conclude our ear assessment. So what I'm going to do is I'm going to whisper 3 things to you, and I'm going to come over here. I'm going to have you cover the one ear, so you're just going to go like this. Okay, don't look at me.
Apple.
Pineapple.
Pineapple.
Peach.
Peach.
Okay, other side. 5,
5,
6,
6,
2.
2.
Okay, good. Positive whisper test. So that's going to conclude our ear assessment and everything.